Talked a little bit earlier about the effect of, or the potential effect of the expansion of Medicaid on different states. And in my state, Governor Beshear recently announced that he was going to accept the expansion. And he did that after a very rigorous analysis of the costs and benefits to both the state budget and also to the state economy. And they found that over 7 years, expanding Medicaid is expected to provide a cumulative economic boost of $15.6 billion through new health spending, the addition of 17,000 jobs averaging $43,000 a year, local and state taxes generated by those workers. The governor also found that expansion would have a positive impact of more than $800 billion on the state budget over that same 7-year period. And that's all in addition to providing coverage for more than 300,000 Kentuckians who do not have access to insurance at this point. So as you move forward and people ask questions about that, I certainly would offer that evidence as proof that the Affordable Care Act, the expansion of Medicaid, is going to be a positive for at least many states. I have one question I'm going to ask, and that's in respect to my former colleague, Steve Kagan from Wisconsin, who spent the entire debate about the Affordable Care Act talking about the need for transparency. And a couple months ago, an incredible piece of journalism, The Bitter Pill, appeared in Time magazine with Stephen Brill talking about the disparity in costs throughout the system, particularly in hospitals. Is HHS doing anything to promote transparency both at the hospital and throughout the provider network in the country?
Yes, sir. We have published a couple months after the Steve Brill article a snapshot of inpatient hospital costs for about 30 different procedures, comparing them hospital to hospital, and found not only enormous countrywide variation, but enormous regional and some places enormous local variation. But it has been published and available. Yesterday, we released additional data, which is the publication of some outpatient services for similar procedures, again, comparing side by side. We've had a process underway really from the beginning of this administration to unlock data, to make sure that the data that we are collecting actually is put in the public domain in an easy to read, easy to use way so that consumers can begin to ask important questions. Why should a hip transplant cost 3 times as much if I go 6 blocks away and have no difference in outcome? So that information is very much available. And yesterday we had the third annual Data Palooza, which is a meeting of entrepreneurs and application developers and others to come in and look at the data and see what kinds of mechanisms they can put together to help drive this data for policymakers and patients. It started in a room with 46 people 3 years ago. Yesterday there were 2,000 techies and entrepreneurs here from all over the country, and a team from the United Kingdom who's really interested in learning what we're doing with data and how that can help inform patients and providers.
Great. Thank you very much.
Mr. Barletta.
Thank you. 10-year-old Sarah Murnahan is